Hi, I'm Dr. Dawn Ewing, the Executive Director of the International Academy of Biological Dentistry and Medicine, proud to bring you Biological Hygiene Part 2, the Diabetic Dental Patient and Dental Infections. Did you know that an estimated 6 million people have diabetes and they don't even know it yet? The dentist or the dental hygienist could be the very first person to suspect it. People with uncontrolled diabetes have higher risk of dental infections, and people with dental infections have difficult time stabilizing their blood sugar levels. Children with insulin-dependent diabetes mellitus are at high risk of gum problems and for increased decay rate. What is glycemic control? Well, it's the key to reducing the impact and risk of oral complications. If we're looking at something like a hemoglobin A1C, and the person has already been diagnosed as being a diabetic, it means that managed, they should be at least 7 or less. If it's higher than that, it's poorly managed. In someone who's not been diagnosed with actual diabetes, the idea would be that the hemoglobin A1C is 5.6 or less. I think it's really important that a hygienist ask every diabetic patient or someone who has insulin resistance what their last hemoglobin A1C was. Diabetes can cause changes in the blood vessel walls, making them thick, reducing the delivery of oxygen and nutrients to the body, as well as reducing the ability to carry away harmful wastes. The increased bacteria thrive on the increased levels of sugar in the blood. This is an obvious gum infection. Really, we see it around more than one tooth, but this one tooth is really involved. We see that the gum tissue is red and it probably bleeds upon probing. In the mouth, this can cause poor circulation to the bone and the gum tissue surrounding each tooth. The increased bacteria in the mouth can cause anything from thrush to spirochete infections. Salivary hyperglycemia, high blood sugar, results in additional bacteria substrates and plaque formations. The person could be experiencing neuropathy. The oral symptoms are numbness, tingling, or burning sensations caused by the pathological changes involving the nerves in the oral cavity, often seen in undiagnosed type 2 diabetics and often resolved after glycemic control occurs. Can it be life-threatening? Yes, there are case reports that have been published on life-threatening deep neck infections from periodontal abscess, or from fatal palatal ulcers in patients with diabetes. Who takes a diet diary anymore? So if carcinogenic foods are eaten often, we know that this increases the decay rate. But who actually takes the time to ask a patient to fill out everything that they put in their mouth for 2 to 3 days? This gives you an opportunity to discuss dietary influences. Some of your patients don't even know what foods are considered carbohydrates. When we look at something like that gum infection, it's a well-documented fact that poor oral hygiene will lead to a higher bacteria count in the mouth. The higher bacteria count will raise the glucose level in the blood. The elevated glucose will increase bacteria levels, so you see that it's a vicious cycle. Your mouth directly relates to your health, and your total health impacts your teeth. So what other dental infections could there be that could affect our diabetic dental patient? How would nature handle this bone if we buried it? What would happen to the marrow and why? Well, I imagine if I buried this soup bone, that bacteria would come and hobgobble all the flesh out of the marrow of this bone, and if I dug it up in a year, it would be completely empty. When we look at a tooth and we section it, we see that the blood vessel and the nerve and the lymphatics go all the way up into the inside of this tooth. When we look at how a root canal is done, and you use the file to remove the blood vessel and the nerve and the lymphatics in the main canals, and then fill it with a gutta percha-like material to try to seal the tubules, that's the idea in a conventional root canal. The issue is it's not just that main canal that we're trying to deal with. If we look at that main canal, it's relatively easy to get the material out of that and then get the gutta percha to go all the way down to the tip. The issue for me is that the sideway tubules are still filled with that marrow-like substance, and that bacteria that was designed to hobgobble the flesh that's in that soup bone manages to find its way inside the body and try to do the same thing. It's anaerobic bacteria, so it lives without oxygen. It's got a dark, moist, warm environment with lots of food, and it tends to multiply. When we take our traditional bite wing x-rays, we can't see the apex of any of these teeth. When we take a periapical, now we can see that there's pathology at the apex of this one tooth. I'm going to suggest in a biological office, not that you tell a patient that every root canal needs to be removed, but that you at least monitor it. When you take your annual bite wing x-rays, I think it's just a smart thing to do to take a periapical of every root canal and compare it to the year before so that you can help this patient before it becomes a dramatic problem, especially in your diabetic patients. It's really rare that you take a periapical on an anterior tooth. Usually, again, we're just taking our annual bite wings. But here's a really good example. This person's blood sugar could be extremely high because of this silent infection that they don't have an awareness about at all. What would you see on blood work? You might see elevated or decreased white blood cells. You might see elevated neutrophils with decreased lymphocytes because this is a chronic low-grade infection, like the film I showed you before. So what if I kill the bacteria? Let's talk about ozone injections, or maybe a Stabident injection of homeopathics right into the bone. Or maybe we're going to use laser treatment of the root canal and try to kill all the bacteria that way. Here's the tooth that was lasered 3 weeks before it was removed. This particular testing is no longer available. It was through Boyd Haley's lab, the Infinity Labeling Technologies, and what it looked at was the amount of bacteria that interfered with the body's production of ATP. So we can see this tooth that was lasered, and the patient was told that the tooth was sterilized 3 weeks before. This tooth was removed, and we see that the bacteria that's actually in this tooth at the 3-week mark is enough to suppress the body's ATP production by 38%. That means this person's going to have some chronic fatigue. This is the same person 6 months later who decided to have teeth number 8, 9, and 10 removed. And you can see that those 3 teeth combined suppress the body's ability to create ATP by 78%. That's pretty extreme, but that's in nature's plan. Again, if we've got 3 miles of tubules of a tooth with that bone marrow or dentin inside the sideways tubules, the bacteria gets in there and it's just doing what it's supposed to do, which is to eat out that flesh, and then the bacteria multiplies. Here's an area where we see a root tip that's been left, maybe accidentally, it doesn't matter, but when we do testing on this, we find that there should be an area of some dead bone back behind this root tip, and I've got an arrow distal to this molar where it looked like in testing there might be a problem. And in fact, that's exactly what we found. The root tip was removed and there was an area where the bone did not fill in with healthy bone. In the area of 13 and then the area of 15, there was a very large void called a cavitation. Each tooth is connected to jawbone by way of a ligament. Of course, in our case, we call it a periodontal ligament, peri or round, and dontal the tooth. When a dentist is trained to remove a tooth, he's asked to do the least amount of trauma possible, which sounds really good if you're the patient. The tooth is removed and everything else is left in place, and then the suturing happens to close up the void. But if I leave that periodontal ligament in there, of course, Hal Huggins likened that to giving birth to a baby and leaving the afterbirth in, which is pretty gross on its own. But if you think about the process of having a blood clot in there, and the brain now sends messages sending osteoblasts and osteoclasts to this area to break up the blood clot, fill in with healthy bone, but they hit that periodontal ligament. I use the example of a wristwatch. If you've got a wristwatch and you see that the second hand is not moving, it's a brand new watch. So you also notice that there's a little slip of plastic. And so when you pull that slip of plastic out, the battery makes contact with the watch and is able to function just fine. So you have everything that you need. It's just that you have a barrier preventing good communication. That's what oftentimes happens in an area of a cavitation. The most common place is wisdom teeth extractions, because the dentist takes out the tooth and doesn't strip out the periodontal ligament. So that's part of the process in a biological office, and why it takes a little bit longer to take teeth out, because we're also lavaging out, which is just washing out, but we're also debriding all of that periodontal ligament to get down to nice, solid, healthy bone. This is what a cavitation area can look like. They can be caused from different things, but this is a dead area of bone in the jaw, and oftentimes this causes a typical facial neuralgia or pain, which Dr. Bocot coined as a NICO, neuralgia-inducing cavitational osteonecrosis, which means a dead bone that's causing pain. You can see that this person was edentulous, and yet you see multiple areas of necrotic bone where there wasn't good blood supply to it. And this is really common in women, where they have this facial pain that's almost like trigeminal neuralgia. Any one of these is considered an infection and can affect your diabetic patient blood sugar. So really, what's the big deal? Well, energy can't go through dead tissue. No, it's not an overwhelming burden for everyone, but it is a burden, and it's more of a burden for a diabetic patient. Does every area require surgery? Well, no, we try things like nattokinase or lumbrokinase or proteolytics to help thin the blood and make it rehydrate areas where there's simple ischemia. Sometimes we can use low-level lasers or homeopathics into those areas. Any area that's larger than a grade 2 on a cavitat, or that shows up in either muscle testing or EAV as a larger burden, may require intervention by surgery, where they go in and open up the thin layer of bone. It's not solid, it's more like a styrofoam, and go in and clean out that side by doing an open bone biopsy. An area this large would certainly require surgical intervention. Remember, electric flow is invisible, not imaginary. So what happens when there's a short or a blockage in a lamp? If we remove part of the wiring in the lamp, obviously it won't work anymore. If I've got a short, that means that the wire may be broken, and when it actually touches and comes in contact, it works. And when you move the wire so that the wires don't touch, then it stops functioning. This is the way the body works. You can have a tooth on an electrical pathway, and now that we've taken out 1 inch to 1.5 inches of nerve and blood supply inside the tooth, we've created a disconnect. So if you're thinking of that as your lamp, you have 1.5 inches of wiring that is not touching it all. There's a space in between. No matter how many light bulbs you put in there, you won't get the lamp to turn on because of that dead air space. No place else in the body do we choose to keep dead tissue. Here's a really good analogy. Years ago in Houston, we had a storm, which we've had several since, but this is a picture of when Allison came through. Think of the freeway here as your meridian. If I could magically take a helicopter and suck the water off of that, cars would be able to use it immediately. The root canal is our water that's there. It's creating a blockage of energy. The moment that we remove that, the electricity is going to be able to flow on that meridian. As soon as you remove the dead air space in the wiring and you splice the wire together so that the wires touch, it will create electric flow and your light bulb will come on. The energy can be blocked at either end though. Really interesting to me when you look at how dental work ends up being symmetrical in a lot of patients' mouths. So when we look at this x-ray and we see that the mesial of the 6-year molar on the mandible has had to have a filling, and yet the bicuspid hasn't had to have any work. The same amount of plaque was in between there, but the molar is on the lung and large intestine meridian, and oftentimes people experience constipation. So you could have less energy available going to that tooth to make it more susceptible to decay than the bicuspid, which is on a different meridian. Just interesting when you start looking at this. Can these root canals or cavitations really be the source of all the health problems for someone? Well, research is now pointing us to links with biofilms and cardiovascular disease. Secondary infections from hidden dental infections can happen any place in the body. You could have someone that has an abscess in a brain because of a root canal tooth, or they have osteomyelitis in a knee because of a root canal tooth. It is truly an issue that we need to give more consideration to. When we look at the oral focal cancer links, it's interesting to note that the P53 is known as our oncogene, which is a tumor suppressant. The P21 controls the replication rates, and the CDK2 controls the size. In 4,000 samples taken from cavitations, which are those areas where a tooth was removed and didn't fill in with healthy bone, and 900 root canal teeth, which were washed 3 separate times to make sure that nothing was coming from the outside of the tooth. These samples had to be diluted 8,000 times just to register. They were so toxic that there was fear from the business that was doing the testing that their employees may be being exposed to something quite hazardous. They were really surprised that these samples came from living subjects, not from cadavers. What we found from this research was that toxins from root canals inhibited the P53 by 99%, the P21 by 68%, and the CDK2 by 67%. Toxins from the cavitations inhibited all 3 by 99%. The beta-tubulin destroyed by toxins in root canals and cavitations was 5 times faster than that of mercury. Now you have to understand that before this research was done, the most toxic thing we knew of in a person's mouth was a mercury filling. And now we were showing that the bacteria that was found and involved with these cavitations was even more hazardous. The effect on the P21 was overstimulations of cells, like in autoimmune diseases, and links were found to things like ALS, MS, lupus, and Parkinson's disease. So could your state of health have anything to do with your mouth? Could the state of your teeth that they're in be a direct reflection of your health? How much health are you willing to give away by keeping some of these hidden dental infections?